Hello, this is Dr. Shamima Sataruna from YouTube channel Doctor to Help. Hope you're all doing great today wherever you are. Thank you for joining me. If you like the video, please don't forget to like, subscribe, and leave a comment to support the channel. All right. Again, thank you for joining me here. Today, we are going to talk about some complications of COVID 19. All right. We all know that COVID 19 can give you post COVID lung syndrome. Um, Maybe some people don't know that it's also known as pulmonary fibrosis, muscle pain, joint pain, fatigue, shortness of breath, memory loss, hair loss. Yes, hair loss can happen too. Persistent loss of smell and taste, seizure, thromboembolic phenomena like stroke, ischemic stroke, as well as other DVT, pulmonary embolism, hmm, and seizure activity. Even mental changes, psychosis has also been reported. All right, today we're going to talk a little bit about pulmonary fibrosis. What is pulmonary fibrosis? What does it mean? Who does it happen to? It doesn't happen to everyone, no. About 30 to 40% of the patients may, with severe lung COVID 19 disease, who were hospitalized, may require may end up having pulmonary fibrosis. It doesn't mean that you only have it in the hospitalized patient. Even young, healthy people who did not require to be hospitalized has been seen to have pulmonary fibrosis. So we need to understand what is going on there. And then we can figure out also what we can do about it if we actually have it or we want to prevent it. All right. So if what happens in a COVID 19 lung? You know, our lungs are made of small, small balloons. Think about a tree with lots of branches. All the ends of the branches end in balloons, right? So, what is making that balloons? There's a lot of elastic fibers there, and they expand when we take the air in, the balloon expanding, and then as we let it go, the balloon collapses. In COVID 19 lung, the balloon, this collapsibility and then expansibility is called elasticity, is lost. What happens? The injured lung is replaced by stiff scar tissue, and this ends up making the lung stiff. When that happens, the lung cannot expand so much, cannot have the same lung capacity as us, the capacity to blow in and let it out. So there's a decreased air intake as well as oxygen intake. So people end up being short of breath, coughing, fatigue, lack of sleep, severe fatigue, and headaches. All right. So, what can we do about it? Who has it? People who have had many severe disease has been in the hospital for about 3 weeks, was on the mechanical ventilator for a long time, whose antifibrotic medications were started also late. Those people will be more prone to it. What can we do once we recover from the acute phase of COVID 19 infection? First of all, we want to make sure there's no infection. If there's infection, like pneumonia, we of course want to give antibiotics, take care of it, right? We want to do an x ray to see what's the situation. Next, we want to do a spirometry. What this checks is how much volume you're taking in and out. These people will not be able to breathe out more than 2 liters per second, which is abnormal. So, the next step for confirmation is a CT scan of the lung. Now, if you do breathing exercises for about 3 to 6 months and you get antifibrotic therapy, most of the cases are reversible. So you should see your lung doctor definitely for the antifibrotic therapy, but the breathing exercise I can teach you. So, what are the breathing exercises you can do? Just a few of them. Think about this. The first exercise is very simple. Breathe through your nose for 3 seconds. Hold for 4 seconds. 1, 2, 3, 4, and then release it over 5 seconds. And repeat about 5 times. All right. This will be your first exercise. The second exercise, I want you to do a few exercises that is concentrating in different parts of the lung. First one is your upper lung. I want you to put your hand on the side of your neck and then breathe in, breathe out. Feel the movement of your hand with the breathing exercise and fill that area filled with air, and do it about 5 times in and out. Next one, I want you to put your hand on the side. Think about it just around your flank area, just above your hips, and just below your flank area. Hold your hands right there, and then try to expend the air right in that area. You should feel the movement of your hand along with it. Next one is a diaphragmatic exercise. Diaphragmatic exercise. Put a hand right under your neck and the second one on your diaphragm. And then concentrate on the hand on your diaphragm. That is just below and above your belly button. All right? Put your hand there and then breathe in, breathe out. Only the lower hand should be moving. Try to hold the other hand as stable. The last one will be just below your rib cage. So put your hands right below your rib cage and the same way. Breathe in, breathe out. Breathe in, breathe out. And the last exercise I will talk to you about is the straw exercise. Take a glass of water and a straw. Yes, you got it. Take a deep breath through your nose and then blow through your straw and make bubbles in your glasses. These are few exercises that I wanted to teach you. Another 3 exercise. One is going your hands straight up. Take your breathe in as you go up and then let it go as you go down. And the same thing you can do on the side. All right. The last one is the spiral exercise. The spiral exercise, you're taking a breath as you turn. And your body turns with you and then release as you come back. Do it on the other side. And return as you let it go. So do it about 5 times each. These are your breathing exercises that you can do at home. And this is good exercise for any lung conditions. Okay, so do some of this exercise. Also, I want you to remember you want to keep a healthy lung. So make sure you're all vaccinated. You want to make sure you get the pneumonia vaccine and the flu vaccine if you're eligible for it, like 65 and above. You want to get the pneumonia and flu vaccine definitely. And if you are younger and you have immunologic conditions, you should have them too. All right. So this is all for now for post-COVID complications, pulmonary fibrosis, and breathing exercise. If you like this video, please like, subscribe, and leave a comment and share with your friends so we can spread the knowledge, so we can help people. That's all we want to do here. All right. Thank you again for joining me. I miss you all. Hope to see you soon. Take care. Bye-bye.